And now on to the next SDGs category. Last year I tested the audience. This was the audience participation piece, so I hope you're ready. As to your knowledge of the SDGs. And as it's our gig, we're going to continue the tradition. Let's see if you're more aware this year. There are no prizes this year, just kudos. So, what number SDG is associated with our next category, which is good health and well-being?
Achievement in sustainable development, health, wellness and disease prevention.
In the category of sustainable development, with a focus on health, wellness and disease prevention, the judges were looking at innovative technologies and interventions which would address major challenges in healthcare. So they were looking at technologies and solutions which would address the issue of how we pay for care, how we can afford the care that is needed, but also how care is delivered and how can people access the right care at the right time. The judges this year saw a wide range of submissions from different geographies, so from Sub-Saharan Africa and Southern Asia. They also saw different types of submissions in terms of the intervention itself, different potential solutions ranging from technologies, mobile technologies or electronic systems to the way care is delivered by healthcare professionals at the front line.
CarePay M-TIBA Mobile Health Wallet, Kenya. CarePay is the developer of the M-TIBA platform, a mobile health wallet that administers healthcare payments between public and private funders, patients and healthcare providers in Kenya. Funds sent to M-TIBA can be used to pay for medical services at accredited M-TIBA health providers. Essilor iMitra Program, India. The iMitra program, launched by Essilor, trains and empowers underemployed rural youth in India to set up their own micro-businesses focused on providing vision screening and selling eyeglasses in their communities. The program is making a transformational impact by reducing rural-urban migration, boosting gender equality and enhancing the quality of rural lives. Glenmark Pharmaceuticals, M-TIBA, India. Glenmark's free voice messaging service, M-TIBA, is given to every woman attending the antenatal department of Sion Hospital in Mumbai, India. They receive clinically tested, individualized voice messages of 60 to 90 seconds in their local dialect on preventive care and simple interventions to reduce maternal and infant mortality and morbidity. Good Life Pharmacy, Kenya and Uganda. In East Africa, 1 in 3 pills is counterfeit. Good Life is a retail pharmacy focusing on access to quality drugs. It is the first professional pharmacy chain to offer consultation rooms in every store and actively push for a rational drug formulary that encourages the use of generic drugs. Hospital Metropolitano, Ecuador. The Social Responsibility Program managed by Hospital Metropolitano has 4 lines of medical intervention: delivering specialist medical consultations, which provide adequate diagnosis and treatments, aiming to increase the life expectancy of patients undergoing medium and high complexity surgery, providing quality healthcare in vulnerable areas with the Medical Brigade program, and working to prevent blindness in children. Anjani Clinics Network, South Africa. Founded on an owner-operator model, Anjani Clinics serve the bottom of the pyramid and other underserved markets in South Africa, ensuring affordable primary healthcare and medicine by allowing selected nurses to access funds and open their own private practices. Wellspring Healthcare Network, India. Wellspring Healthcare operates a network of 33 primary healthcare clinics in India under the brand HealthSpring that deliver high-quality and affordable healthcare services. Each clinic offers doctor consultations, pathology, radiology, pharmacy, and 24/7 emergency response, all under one roof.
Amazing. To present this award, we're pleased to invite again one of our judges, Kanini Mutuni, who's the director at the East Africa Trade and Investment Hub.
So, the winner of this category, in the words of the judges, has reduced barriers to quality healthcare in Kenya. They have ensured transparency and generated data that can be used by hospitals and donors to improve services. The award goes to CarePay M-TIBA Mobile Health Wallet.
I've been always accused of not being objective, so I will set the record straight by saying that you did a good job by voting us as the finest of the submitted projects. You know, CarePay is developed, M-TIBA is developed by CarePay, FarmAccess, and Safaricom, and is creating a movement in Kenya to finance and deliver quality of care. You know, think of it this way, that Africa has only 15% of the world population, but suffers from 40% of the disease burden. So there is the need for innovative financing and delivery of care. And we believe from CarePay, from FarmAccess, from Safaricom, that there are enough resources in Africa. What is needed is a technology that will ensure that the financing is targeted to people who need those financing, and also that we create transparency to monitor the effectiveness of those resources. So you've made my day. It means a lot. Like I said before, you know, Africa has 15% of the world population, but suffers 40% of the global disease burden. So there's a need for financing and quality of care to get rid of those challenges. And this Innovation Award presents the platform for us to really showcase what we do and mobilize support for the work.